With warmer weather comes an increase in tick activity. Black-legged, or deer ticks, can cause infections such as Lyme disease. Southwestern Public Health reported 45 cases of Lyme disease in 2025, up from 36 in 2024. Kitty Chan, manager of environmental health, says tick population is increasing likely due to climate change.
The environment becomes more suitable for tick population. It also lengthens tick activity season, and that's why we're seeing tick-borne illnesses becoming more common.
To best protect yourself against ticks, you should wear closed-toed shoes, pants tucked into your socks, long-sleeve shirt, light-colored clothing, and use bug repellent with DEET. But it's not just on hiking trails like these that you have to be vigilant.
We are seeing more ticks in people's backyards, even in urban areas. So always, it's a good reminder for everyone to take prevention strategies so then everyone can enjoy warmer weather in outdoors.
Each time you come in from outdoors, you should check for ticks, especially around the neck, ears, underarm, and groin. If you do find a tick, remove it quickly with a tick removal device while making sure to also remove its head. The online tool etick.ca can help identify the tick species. In St. Thomas, I'm Scott Navarro for Rogers TV.
Concerning data from the CDC shows tick-related ER visits in April reached a high not seen in a decade. In Clinton County, New York, health officials say they've only recorded 9 cases, but say that most are diagnosed without lab confirmation. And at the Champlain Valley Physicians Hospital, staff say they've seen an uptick in people receiving emergency care for tick bites. Health officials say to remember these steps if you find a tick on you.
The sooner the better. Using a fine tip tweezers, just take it right at the skin level and pull it right out straight. Don't twist it, don't soak it in anything, just pulling it right out with the tweezers is the best.
She also says you should use approved tick repellent, wear long clothes, and avoid tall, grassy areas.
Three people have died in an outbreak of a rat-borne disease on a luxury ship. So what exactly is Hantavirus, and should you be worried about it spreading?
They're relatively rare infections.
Daniel Bausch is a specialist in tropical diseases at the Geneva Graduate Institute in Switzerland. He said the virus is only rarely passed between humans and is most commonly spread when people have contact with rodent droppings, urine, or saliva. But a cruise ship might create the conditions for person-to-person infection.
We know that cruise ships and other events where we pack a lot of people into small places, that they always have the risk of human-to-human transmission of different pathogens.
Hantavirus usually begins with flu-like symptoms such as fatigue and fever. 4 to 10 days later, coughing, shortness of breath, and fluid in the lungs appear.
And so we can see in hantaviruses that people develop essentially a pneumonia or a consolidation of fluid filling up in their lungs, and that can happen very rapidly.
Bausch says there's no specific antiviral drug for hantaviruses. Treatment, he says, often requires hospitalization in an intensive care unit.
It's not the sort of treatment that is generally available on a cruise ship.
The World Health Organization said it's been told there were no rats aboard the ship. Its working assumption is that the cases originated in a Dutch couple who joined the ship in Argentina. That couple may have been infected before joining the cruise.
Hantaviruses have or can have at least a relatively long incubation period. Incubation period is the time from when you get exposed to something to when you fall sick. And so in hantaviruses, that can be, in extreme cases, up to 6 weeks.
The World Health Organization assesses the overall public risk from this current outbreak to be low.
This is not the next COVID-19. This is not going to be a big outbreak. This is not a reason for your average person in the world to panic at all. If you had tickets for a cruise, I don't think you need to cancel it now that you know that it's possible, because it's pretty rare.
Deadly outbreak
outbreak on a cruise ship tonight in the Atlantic Ocean. 3 people are dead, dozens of passengers stuck on board. It was supposed to be a once-in-a-lifetime Antarctic cruise, but it took a deadly detour after a suspected Hantavirus outbreak.
Rachel Menitoff joins us live in the KTLA News Center with more on the health emergency. Rachel.
Sure, Micah, there are still 149 people on board, including 17 Americans. They haven't been approved by local authorities to leave the ship at all. One passenger tonight is describing the fear and the uncertainty on board as the cause of the outbreak is still unknown.
What's happening right now is very real for all of us here.
On his Instagram, Jake Rosemarin says he's traveled to 100 countries and counting. Right now, he's on a 46-day luxury cruise touring the Antarctic Peninsula. But at the moment, it's docked off the coast of Cape Verde, an island near the west coast of Africa, and is essentially under quarantine-like conditions. 3 people died on board the MV Hondius. 1 is in intensive care, and 2 crew members are having respiratory symptoms and require urgent medical care after a suspected hantavirus outbreak. Health officials have confirmed at least 1 case of the rodent-borne virus and are investigating the 5 others.
All we want right now is to feel safe, to have clarity, and to get home.
Travelers are not allowed to get off the ship, but local health authorities are visiting and assessing the 2 symptomatic people on board.
This is not completely abnormal to see a case, but we've never seen a case on a cruise ship.
Dr. Anne Ramoyne, an epidemiologist at UCLA, explains people typically contract the illness by inhaling particles of rat or mice urine, feces, or saliva. You may remember it's the disease that killed Betsy Arakawa, the wife of late actor Gene Hackman, in their New Mexico home last year.
We need to know who got it first. Where did they get it? Did they get it before they boarded the ship? Did they get it on the ship? Did they get it while they were disembarking in one of the places that they were at?
Hantavirus is a family of viruses, and there's only 1 type known to be transmittable from person to person, but it's rare. It's typically found in Chile and Argentina, where the cruise ship started its voyage more than a month ago. It's hard to tell exactly what type of hantavirus this is. In the meantime, the cruise company says it's working with the World Health Organization and is considering sailing to the Canary Islands, where it's easier to evacuate the group and get more medical help.
So if you're seeing coverage about this, just remember that there are real people behind it, and that this isn't something happening somewhere far away.
And this is a serious situation, but the WHO emphasizes this outbreak does not represent a public health threat, and there's no need for panic or travel restrictions. In the News Center, I'm Rachel Menitoff. Back to you.
This app is fantastic.